Welcome to Arirang TV's special coverage of the COVID-19 pandemic. I'm Min Sun-hee. The number of coronavirus cases worldwide has reportedly topped the 1 million mark after the first case in China some 3 months ago. The death toll also stands at around 53,000, and amid those who've passed away are young people with no prior health conditions. A saddening and sobering reminder that the young and healthy are also vulnerable to the virus. We have more on that later on the program. First, as always, we take a look at the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
So I understand we're starting with the figures overseas today.
Right, and as you just mentioned, we have surpassed the 1 million mark. So that is really an alarming milestone. And also what's concerned is the fast spread of the virus, because just last week on March 26th, we had 500,000 global cases, which means the number has doubled in the span of a week. And we are talking about the confirmed cases, meaning the number could even be higher than that. Now, more than 200 countries and territories around the world have now been affected by the coronavirus ever since the outbreak started in the Chinese city of Wuhan in December. Around 53,000 people around the world have lost their lives, according to latest data by Johns Hopkins University. More than a quarter of these deaths occurred in Italy, and the U.S. has more cases than any other country, where stay-at-home orders are now in effect for over 90% of Americans, and a record 6.6 million people filed for jobless claims. Meanwhile, health experts at the White House predicted mid-April to be the peak in the country, with more than 2,000 deaths likely to be reported daily. Now, where there is already a cautious analysis of the worst being over is in Europe, but the numbers, if we take a look, do not look relieving as of yet. Italy and Spain have more than 110,000 cases. Spain's death toll has also exceeded 10,000. Germany now surpassed China in total infections. Meanwhile, more than 210,000 people around the world have now made a full recovery of the virus. So to end on a good note.
Right, and hopefully that number will rise in the near future. I understand cases here in Korea have also surpassed the 10,000 mark.
Right. Along with the global milestone, here in Korea, the number of total cases has surpassed the 10,000 mark Friday in accumulated cases, that is. And we have 86 new infections as of 12 a.m. And according to the government, that's 74 days since the first outbreak. But authorities are stressing the fast recovery rate, as we're seeing more than 6,000 people have been discharged from quarantine and completely recovered. Soon, that will be double more than the number of patients still in isolation, as that number is just short of 3,900. Deaths are still reported on a daily basis. Today we are seeing 5 new cases, and out of the addition of 86 new COVID-19 cases, 48 are domestic cases, 38 imported cases, and we're seeing that Seoul has some we have 23 cases in the Gyeonggi-do province and 18 cases in the capital Seoul. So the metropolitan area has more cases than down in Daegu, for instance. And that is why authorities warned that social distancing measures should be followed over the weekend, especially in the metropolitan region, to refrain from, meeting people in enclosed spaces as well as crowded places. And that's why many outdoor spaces like parks have been closed off in concern they could be packed with people going outdoors to enjoy the warm spring weather. Now, meanwhile, one person out of the 200 people that arrived from Rome yesterday has tested positive for the virus. Some 20 people have been seeing some symptoms of the virus, and all 79 people that returned from Iran last month have been released from isolation facilities today, as they all tested negative for the virus.
Well, that is good to hear. Now, aside from that, well, thank you so much for that.
My pleasure.
Now, while they are people from Iran and Rome, Koreans are here, we still have many Koreans stranded overseas, but we can expect to see them in the near future, I understand.
Yeah, that's right. A flight has been arranged to bring home some South Koreans who are in Russia. They're scheduled to arrive next Wednesday, Korea time. Now, this actually comes after some hurdles they faced back on Monday, because a flight that was originally scheduled was abruptly cancelled on Monday. And about about 270 Koreans reportedly applied for that flight. So we could be seeing a similar number coming next Wednesday from Russia. 5 Koreans in Serbia, meanwhile, are on their way back home as well. They are in the air as we speak. They've boarded a cargo plane, in fact, that is being sent by Serbia to collect Korean medical supplies, because Serbia has purchased some Korean medical supplies. So these 5 Koreans, because it is a small number, they are boarding this cargo plane. And hundreds of Korean nationals in India are also due back. Some 250 of them are scheduled to depart Delhi on Sunday, with hundreds more to arrive next week after negotiations with relevant authorities. The Korean government is also in talks with New Zealand to repatriate Koreans, but a schedule hasn't been set yet. But I do predict that it will be set soon. And Korean nationals in a few other countries in Africa and Southeast Asia are also scheduled to come back soon. But a final timeline hasn't been determined yet.
I see. The weather's getting warmer here in Korea, but it seems like the virus is likely to continue. So we'll probably have to stay home this weekend as well.
Yeah, and this time of the year is usually the time of year when cherry blossoms are at their bloom, albeit this year they've come out a couple of weeks earlier than usual, actually, and people who had planned to go out to see the colourful flowers will be disappointed, unfortunately, this year. So they'll have to probably wait until next year to see them. Now, many spring festivals have been cancelled, along with many walking trails in Seoul and other cities where there is an abundance of these cherry blossoms. The biggest Yeouido Cherry Blossom Festival in central Seoul has been cancelled this year, as well as one in southern Seoul as well, near a place called Yangjaechon. About 1 million people were actually said to have visited Yeouido Park last week to see the cherry blossoms, but this has obviously sparked some concerns over a possible secondary infection or another cluster infection. And since the flowers will be still blooming even with the festivals being cancelled, regional and city governments are shutting down parking lots and blocking trails to keep people from gathering on the sidelines of these festivals. Anyone travelling through Yeouido, do take note that a 1.6-kilometre stretch of Yunjungno behind the National Assembly is closed off to cars until the 11th and until the 10th for pedestrians. To keep people from going out to parks by the Hangang River, meanwhile, the city government will also crack down on anyone setting up tents to prevent gatherings.
Now, while the outbreak is hurting humans, us and our economy, it seems that the planet is doing better, Aram.
Yeah, so quite an unexpected impact of the coronavirus pandemic is the reduction in air and water pollution, in fact. And with factories shuttered and cars parked in garages and airplanes staying in their hangars, obviously the air pollution has dissipated in some cities that are notorious for pollution as well, including cities like Beijing and New Delhi and whatnot, as well as some major cities in the US and Europe as well. And satellite images from NASA and other space agencies show that the last couple of months have seen a huge uptick in air quality. Air pollution kills more than 4 million people worldwide annually, and over 1 million in China alone. So it has a far bigger death toll than the coronavirus itself. In Italy's canal city of Venice, meanwhile, the waters there are also noticeably clearer, and there are also some sights of underwater wildlife being seen. There's some fish swimming around in there as well, which is not a usual sight that you see in Venice because it is mostly clouded. But all this doesn't really mean that COVID-19 should be ignored and it should not be seen in a good light. There is still concern over the virus, so that's why environmental and policy experts are saying that this is not a silver lining. It is only temporary. So the pollution levels will start rising again once the virus subsides. And also they are encouraging or urging for policies that reduce pollution in the long term and not something that will cripple the economy worldwide.
Right, Aram. Okay, thank you for that. Aram Swa, we'll probably see you next week with more of the headlines. It's time now to turn to the Central Disaster and Safety Countermeasure Headquarters for the regular briefing. With cases of coronavirus continuing to climb across the globe, authorities here are underscoring the need for members of the public, that is, to refrain from engaging in activities that confine them to crowded indoor spaces. After the first infection of COVID-19 some 3 months ago in China, the number of cases, like we mentioned earlier, worldwide has surged past the 1 million mark, prompting government officials to impose drastic movement restrictions with stern legal action against violators. Korea, for its part, has seen its cases move past the 10,000 mark today. Now, we're still waiting for the briefing to start, but here we see officials getting ready for it. They'll probably talk more about the facts and figures surrounding the latest here in the country. They are taking seats now, and we have our official approaching the podium. We'll be back after this briefing.
Let us now begin our regular briefing for the coronavirus outbreak here in South Korea. As of today, the total number of confirmed cases stands at 10,062. This includes the 647 imported cases from overseas, and 56 of them were foreigners. And of the total, 6,021 or 58% have been discharged following full recovery. Yesterday, we had 86 more cases and 193 more people were discharged following full recovery yesterday. And we have a total of 3,867 who are on quarantine, which is about 34.8% of the total. And we had 5 new fatalities yesterday. And I send my deepest condolences to those who have passed away and their bereaved families. And the regional breakdown of the confirmed cases is as follows. Yesterday, the newly cases, the 86 of them. In Seoul, we saw 18 new cases. 18 new cases were related to overseas imported cases. And also there was the cluster infection in the Manmin Central Church in Gurogu District. And Daegu, we had 9 more cases. This was relating to the second Miju hospital, as well as other contact tracings, where and we also have seen some imported cases as well. Gyeonggi had the largest number with 23 yesterday, and they were also related to the Ujeongbu St. Mary's Hospital, and we were reported by the municipal government. And the Gangwon region, they also saw the related cases relating to the Ujeongbu St. Mary's Hospital. In Gyeongbuk, we had 5 new more cases relating to the Gyeongsan City Seoul Nursing Hospital. And yesterday at the airport quarantine, we had a total of 22 confirmed cases. And at the Gyeonggi-do Ujeongbu St. Mary's Hospital, we had 5 new cases yesterday. And right now the total stands at 27 for this hospital. And we are currently investigating under these contact traces as well. And right now, we have confirmed that the 27 were 10 were the patients, and the 7 were the family members of these patients. And the inpatients are also put on quarantine, and the contacts have also put on self-quarantine, and we are tracing the contacts. And in Daegu at Dalseong district, we had 6 more cases at 2 hospitals, and another confirmed case at a different hospital. And at Seoul Nursing Hospital in Gyeongsan City, we had 4 more cases, and the total stands at 65 for this specific hospital. And recently, overall, globally, we have seen a surge in the outbreak of the infections, and the government has put in place a stronger infectious disease control measures to all of those who are arriving to South Korea. 38 have been confirmed yesterday, and 3 were from Asia, excluding China. 2 were from the Philippines, and 1 came from Indonesia. 20 came from Europe, and 15 came from Americas. And they were reported, 22 of them were reported at the airport, while 16 have been reported within the community. 2 people were foreigners. And as of now, the imported cases stands at 647, 52 of which are foreigners. So 92% of them are Korean nationals. And all of those who are coming in from Korea from overseas, they will be mandated to submit a health document of their conditions, and they are also screened when they have symptoms. And if they do not have symptoms, they will be put on self-quarantine for 14 days. And foreigners on a short-term visit, they will be subject to self-quarantine at designated facilities. And those coming in from Europe, they are mandated to have screening testings. And people who are returning to Korea from overseas, we advise them to return home straight after arriving at the airport, and they should travel in their own vehicles or designated airport limousine buses or designated KTX trains. And we are seeing some reported cases of the contact infections among those who are on self-quarantine. So we advise them to use their own utensils and items, and we also advise them to strictly abide by the self-hygiene measures. And as for the family members and roommates, we ask all of them to wear face masks and ventilate the homes and wipe and clean and disinfect the frequently touched spaces. And if you show symptoms, you need to immediately report to our authorities through the call center or the application on your phones. And until the 5th of April, we are intensifying our social distancing campaign. And recently, we have seen cluster infections related to religious activities. So therefore, we ask the public to refrain from going to these religious centers. As for the Banmin Central Church at Kurogu District in Seoul, they have turned their services to online starting from a few weeks back. So they were able to prevent a big cluster infections, but still we have seen that they have 41 cases confirmed, and also a total of 140 people were the contacts of these people, and the total of the confirmed cases were 45. And also there is in Chungnam a church where we are conducting the screening for 360 people, and we have 7 who have tested positive, and we have 32 contacts who have come into close contact, including at workspaces. So we emphasize this numerous times, but we ask you to refrain from religious activities that are carried out in enclosed spaces and which are crowded. So the infection rate is very high. So during the weekend, we ask you to stay at home as much as possible and refrain from indoor activities in enclosed spaces. We also ask you to abide by the personal hygiene measures, including washing of your hands and coughing etiquettes. That's all. Thank you very much.
Right, and that was Chung Eun-kyung, head of the Central Disease Control Headquarters, with the latest on the COVID-19 pandemic in Korea. Korea has reported 86 new cases, raising its total number of infections to 10,062. Amid concerns over cluster infections and imported cases, authorities here are urging people to practice good hygiene, avoid crowded places, and do wear a mask, even indoors, if you have a person who's self-isolating at home.
Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks, or even kill you.
We don't really say Corona. It's like a drinking game.
Now, there has been a rapid rise in the number of infections among people in their 20s worldwide. And what's more concerning is the death of such healthy young adults. For more on the impact of COVID-19 on these young people, we have Professor Kim Tae-hyong from Soonchunhyang University. Welcome, Professor. And we have Steven Borowiec, a freelance journalist based in Seoul. Hello, Steven.
Hello.
First, Professor Kim, what is the percentage of young COVID-19 patients in Korea?
Actually, the number is quite high compared to other countries. I think by yesterday's statistics, 27% of infected patients are patients of 20s, which is a very large population compared to what we have heard from China.
I see, that is quite concerning.
Yeah, it is.
What's the situation like, Stephen, in Canada? Do we also have a steady rise in the number of infected young people?
There is. In Canada, the total number of cases is over 10,000 now, and roughly 1/3 of those are people under 40, so not specifically in their 20s. But another more alarming statistic is that people under 40 account for 12% of all hospitalizations. And so that means that at least some of these young people are encountering symptoms that are serious enough for them to require immediate care. So in Canada, officials are saying that the country is at a kind of critical juncture for how they may or may not be able to manage this, and young people are a key part of that.
Professor Kim, surely people in their 20s have a high level of immunity. Yes. Why are we seeing a continuing rise in infection among these people?
Usually the coronavirus, not only the COVID-19, but the usual seasonal coronavirus have equal number of percentage for every ages. So we have a relatively highest number of cases in elder people, but so which is very different from flu. But in Korea, we have a higher number of younger people. So I think we have three kinds of suggestions. One, first, because this epidemic was imported from China originally. So we have younger people who might travel, who have the first infection from China. And second is because of Daegu outbreak, because the Soonchunhyang religious sect, these religious people are mostly younger university students. So we have a highest number of these people was infected. And third, because recently we have more and more patients from North America or European countries. So these students are usually in 20s ages. So this is the reason why we have a higher number of this age group.
I see. Stephen, do you suppose that younger people are less concerned perhaps, or less aware about the severity of COVID-19?
I'd say two things. Number one, I think the awareness is growing. I think that more young people are becoming aware of the risks of this illness, and just because you are young and otherwise healthy does not necessarily mean that you do not need to take precautions. That being said, I do think it is somewhat difficult for a young person who's never experienced a serious health problem before to grasp the seriousness of something like this. The word invincible has been thrown around, and when I was young, I certainly thought that I was not vulnerable to the types of public health crises you might hear about. But that being said, I do think everywhere you look nowadays, we're hearing stories of young people being infected and of community transmission, and the sentiment that we are all really in this together. We keep hearing that, and young people are not invincible, as the WHO official pointed out.
That's true. Stephen, if you have any question you'd like to ask Professor Kim, please go ahead at this point.
Professor, in your practice, how do you get young people to understand the seriousness of this risk, and how do you communicate to them that they also need to take precautions?
Because fortunately, we have a higher number of these people infected, but 0% of fatality until now. But it's because we have only the small number of cases. See, if you have an increased number of young people who have infection, we probably have, even the percentage is very small. Very few patients may be very in severe cases, in critical situation. So we already have that kind of situation in many countries. So this is not a totally safe disease for young people. So I let them say that it is very basic precaution is very important to protect themselves and also their parents or grandparents as well.
Professor, even more saddening is the case of these infections among very young people, underage children. We have a 9-year-old in Korea, 13-year-old in the UK. We've even heard stories about a 12-year-old in Belgium passing away, and a 6-week-old baby in the US also dying from COVID-19. What are your thoughts on this?
Usually, these young children are very healthy, and they are more suspected to be protected from the disease. But they will inevitably be infected if their mother's infected. So, and also, these little children are maybe very contagious when they are having school. So they may have a cross infection from their peers. So and also some population may have a severe infection, like a cytokine storms kind of a disease. Actually, this was not proven in this country, but we have a similar experience in many viral respiratory disease. So even very young children, over age 10, may have very severe fatal cases, not explained by their disease because they were previously healthy. But these children may have a serious condition.
Professor Kim, perhaps you'd like to explain about the cytokine storm.
Yeah.
We keep hearing about it in the news for our viewers.
Yeah. Actually, what we have suspected in Daegu, because we have one fatal cases of a 17-age boy, but this was not totally proven by COVID-19. So it's probably other kind of virus infection. But this similar situation may happen to COVID-19 because, you know, the cytokine storm is not only reserved to COVID-19. You can have this kind of complication, even in influenza and other virus infection as well.
I see. Professor Kim, there's also concern that young patients could become quiet transmitters. Do you care to elaborate?
Yeah, so we call the R0 or R0. This is the basic reproductive number. So this potential of a reproductive number may be about 2 to 3. So that means in this epidemic, if one child is infected, he can transmit to 2 or 3 other cases. But so because the young people are very close in school, so we may have a lot higher possibility of infection among these people compared to adult people. So I think these kids are very vulnerable population regarding the infectiousness.
Which is why we've closed down schools then.
Yes.
I see.
This happened also in the pandemic influenza too, because usually children was the main source of transmission for influenza.
We have a growing number of young Korean students returning to Korea from overseas, and this has raised concerns about imported cases.
Yeah.
Are you also concerned, Professor
Yes,
Kim?
this is what we call the third wave of coronavirus in Korea, because we have a growing number of students who study in North America and EU and UK. Because Koreans are very enthusiastic in terms of education. So there's many parents who send their children to many countries to learn English and other stuff. So, because they are living in this country, which are many outbreaks of COVID-19, especially in North America and European countries, so probably their school will be closed. And also the healthcare system in this country is a very critical situation. So for their parents, I think many parents will decide to make them to return to home country. So this is the reason why there's many our students coming back to Korea.
Right, that really is a reality. And staying on the topic of young Korean students returning from their studies abroad, up next we have a video clip of one such scholar as she makes her way back to Korea from England. Let's take a look.
I'm Jeong-won, who is studying fashion in the UK university. This is my studio. Is the room quite messy, right? Because I have to leave this place in 3 hours. I've packed all my baggage as well. The reason for my return to home has been announced that it is okay to return home from university. So this is the email from university. My professor said it's support for international students to be allowed to return home early. Europe is currently in a very serious situation. Boris Johnson, the Prime Minister in the UK, said herd immunity, which is the situation where you get so many people in the population to develop an immunity to a disease that there is no opportunity for the disease to actually become established and spread to lots of people. Now, Boris has coronavirus. I feel very scared. So many international students want to go back to their home country because we thought this is not a proper way to overcome this situation. Unfortunately, the price of airplanes increased 3 to 4 times. I paid £1,300 for just one-way ticket. I have no choice, but I should leave this place. I got on the train. I'm going to the airport now. I arrived at the airport. I'm going to Korea by plane at 12:10.
Now, as we just saw, Lee Jeong-won returned to Korea from England on March 31st, and she is currently self-isolating. She has nonetheless agreed to share her experience with us live on air. Hello, Jeong-won.
Hello, nice to meet you.
Nice to meet you too. How are you feeling, and what's it like to be back in Seoul from the UK?
Yes, I am currently in self-quarantine, and I'm feeling good at the moment. I have no suspicious symptoms now.
Jeong-won, you were examined through the walk-through testing booth at Incheon International Airport. Tell us a bit about that experience.
The quarantine procedure at the Incheon Airport was very systematic. As soon as I arrived, the soldiers helped people stand in queues, and the doctor asked symptoms one-to-one in the booth and checked their condition. The coronavirus test takes about 1 minute, and people have to wait 8 hours for the test result to appear. If people have symptoms, they can be quarantined to the hotel by private bus and wait for the result.
Jeong-won, I understand you live with your parents, your family, here in Korea. How are you managing to self-isolate yourself with them when you're within the same boundaries? And what are some of the discomforts you're facing because of this isolation?
Yeah, so I try to stay in my room alone to minimize contact with my family. I usually wear a mask at home, and I've been eating my meals alone.
So you're spending quite a bit of your time alone in your room then?
Yeah.
Steven, if there's something you'd like to ask Jeong-won, please go ahead.
Jeong-won, what kind of contact, if any, do you have with the government? Do you have people checking up on you to make sure that you're following protocol?
Yes, the government are keeping an eye on me. When I arrived at the airport, I had to install a self-quarantine safety protection application. And then public officer contact me. Through this app, CDCH can check my condition and look after me.
Jeong-won, on the studio today, we also have an expert, a health expert, Professor Kim. If you have any questions you'd like to ask him right now, please go ahead.
Yeah. Professor, is it safe to go outside after self-quarantine?
Yes. First of all, I expect Jeong-won for your patience and your effort. So it's only 2 weeks to quarantine, but after the 2 weeks, you should remember that you are still have dangers. This country is also in epidemic, so you should keep your self-hygiene and wear masks for every time that you meet your friends. So you should use your personal hygiene in best way, but you can visit your family and your school friends thereafter.
Right. Jeong-won, also put a mask on, and apparently tell your parents to put a mask on as well, because the Central Disaster and Safety Countermeasures Headquarters said you need to put a mask on, a face mask, even at home if you're self-isolating. One last question, Jeong-won. I understand your departure from England was quite abrupt. Do tell us how you feel about that and about your future plans here.
I feel very sad and embarrassed about this situation, but I can attend classes online here. And even though self-quarantine is finished, I plan to focus on writing a dissertation for the sake of my degree.
All right, Jeong-won, good luck with that. And thank you again for being with us with your experience.
Yeah.
Right, that was Lee Jeong-won returning to Korea from Seoul. Steven, we heard about the entry protocols from Jeong-won. What are your thoughts about that?
Well, it seems at this point that they're necessary measures. I think it's a reflection of the seriousness with which the Korean government is taking this outbreak. And I think that kind of assertive response is one reason why South Korea has been comparatively successful in keeping a lid on this outbreak. And it's one of the things that I think some countries abroad are now looking to Korea as an example to follow.
Professor Kim, just like our Jeong-won, starting from April 1st, all arrivals to the country, regardless of your departure point, need to go into self-isolation, even if you're not exhibiting any symptoms. What do you think about this quarantine measure?
I think it's very, very important because this country is no longer an authoritarian country. So we have more. So the social distancing is very important for every people, especially for the returning people. So for returning, it's having social distancing means 2 weeks of quarantine. So as what the Latin word originally think is the 40 days in Latin. Quarantine means 40 days in Latin, but it's only 14 days. It's not 40.
That's quite interesting.
Yeah.
So in Latin it means 40, but you only need to be in isolation for 14
days. Yes.
That's not a very long time.
So we expect our citizens voluntarily action. So we hope our citizens and foreigners who are resident in Korea will follow the guideline properly. So for the health and safety of everybody. So
we also have penalties in place to make sure that they abide by the self-isolation measure. Right. What do you think about our penalties, Steven, regarding if you violate this self-isolation period? You could be deported as a foreigner, you could face jail time as a Korean. What are your thoughts about these measures? Are they too dramatic or drastic? Or?
For any of these measures to work, there has to be some kind of enforcement. There has to be some kind of incentive to follow them. If someone is ordered to do something like this and then there's no penalty, then they might not be incentivized to do so. At the same time, I just hope that everyone is taking them seriously, not because there is a possible penalty, but because in a public health outbreak like this, all citizens, and even if you're not a citizen, if you are a resident of a country, I think we all have a responsibility to band together and to follow the protocol handed down by the government and to do things like wear masks and social distance and to maintain our own personal hygiene. So the punishments, I think, are a key part of the package, but I hope that even in the absence of punishment, we all feel compelled to maintain these certain guidelines.
Staying with the idea of punishment, Steven, do you have such legal repercussions in Canada as well? I'm sure self-distancing or social distancing is important there as well. Are there any legal repercussions to be faced if you violate those rules?
Well, I'm not aware of any legal repercussions specifically, and as far as I know, as a Canadian, I haven't looked too much into the idea of what foreigners would be vulnerable to there. But the Canadian government is asking anyone who returns to the country to self-isolate as a quarantine for about 14 days. And Canada, I think right now is at this sort of threshold period. Canada is a big and sparsely populated country, so I think it's maybe a little bit easier for people to maintain social distance. And it's also, the weather's not all that nice at this time of year, but hopefully over the next, even in the absence of any kind of legal repercussions, Canada will be able to have some more clarity on the outbreak there.
Right. Now, while the weather is not that nice in Canada, the weather here in Korea is getting warmer and it's really nice outside. So I do see quite a lot of young people at wining and dining establishments, regardless of the social distancing recommendation. What do you think about this? Will this not raise our numbers further? How can we get these young people?
I think it's it will be very important to inform them that they are still in danger. And also wearing mask and having social distancing is very important to not harm others. Not only protect their health, but also to not harm others. So I think it's great that we have a more habit of having mask compared to North American peoples. But it's very important the wearing mask is not only protective to themselves, but more likely to protect the other people from getting sick from me. So it's very important to have that kind of ethical idea.
That's true.
Yeah.
If I may jump in and ask you a question to Professor Kim, do you think that nowadays online there's this interesting graph circulating identifying countries in East Asia like Korea and Japan and a few other places that have had flatter curves compared to much more drastic curves in some European countries, and attributing that difference to the widespread use of masks. Do you think that the use of masks is that important, that it has a very pronounced effect like that?
Yes, but also because of the healthcare system, which is easily accessible in this country, have probably made people for easy diagnostic workup. So probably because we have a large number of hospitals compared to population. Because previously we thought that in Korean hospitals we have too many large hospitals in Seoul, but in such a critical situation, that help for protect the people from getting sick, and also the public health oriented policy, governmental policy that help the people to go easily hospital to get diagnosed and get treated faster. So probably that is kind of success in East Asian countries like Korea and Taiwan and probably Japan. Yeah.
Right. Staying with the idea of masks, Steven, what is it like in Canada, the response to wearing a face mask? Is it accepted? Is it not accepted? Do you wear a mask here in Korea?
I have to admit that in the early stages of this outbreak, I was a little bit resistant to the idea of wearing a mask, because what we tend to often hear in the West is that masks are for people who are ill, and that one ought to wear a mask if you are sick, if you go in public, not to protect yourself really, but to protect others around you, as Professor Kim alluded. I have now decided that I will wear a mask always in public.
Why?
And what changed my mind was, even that being said, that masks are primarily for people who are already sick. If you have a society where every person, whenever they go in public, is wearing a mask, and so all of those people, when they sneeze, when they talk, when they emit any kind of bodily fluid, they're wearing a mask. That just must result in fewer infections, because if someone is on the subway and they're talking on the phone and some of their saliva ends up on a handrail and then someone later touches that. So I am now a firm believer, and I would like to share with all the Western people out there that this is not something that's only for societies in other parts of the world. This is useful to you too.
Right. Thank you for those words, right? Professor Kim, apart from wearing masks, what else can we do to protect ourselves from COVID-19, do you think?
Basically, what is more important is washing hands with the soap and disinfectant.
One question, is it better to wash your hands, or is it better to use those sanitizers that we see in
both.
buildings?
Yes, both.
Both?
Yeah, both.
They're equally as effective?
Yes.
I see. What else then, apart from?
And also, I think what we have less adopted compared to other Eastern Asian countries is the respiratory etiquette, because in our culture, coughing is not really an excuse compared to Western culture. So many Koreans can easily cough, but it's very important to protect the other people from my cough.
So to cough into your elbow.
Yeah, so that's kind of respiratory etiquette. I expected that Korean people will be more used to that respiratory etiquette after MERS outbreak in 2015. But unfortunately, we still have people who cough, in public. So it's very important to have a more more advanced etiquette for every people.
All right, Professor Kim, thank you very much for your thoughts. And Steven, again, thank you very much for being with us today. And that is all we have for today. Thank you, as always, for being with us. We'll be back on Monday, so do join us then for more updates on the COVID-19 pandemic. In the meantime, do share your thoughts and inquiries with us through our social media accounts or through our homepage, arirang.com.